doing wound care sterile to wet to damp dressing today. You have the checklist that you should have printed off a blackboard that will walk you through this. First of all, we're going to check our provider's orders and the facility's procedures and protocols. We're going to gather our necessary supplies. We need a 4x4 pack of sterile gauze sponges. We need tape. We need sterile normal saline or the prescribed solution from the facility. Need cotton tip applicators, and we actually will probably need a couple of packages of those, and you'll see why in just a moment. Need forceps and scissors. They usually come packaged as a suture removal kit. It can also be a dressing kit. These are the ones that we use in lab, so they're just a little bit more. We'll pretend that they've not been opened. Need a wound measuring device. You won't measure the wound every time you change the dressing, but at the same point in time, you will want to do it every how often as prescribed by the doctor or the healthcare provider. We need an abdominal or an ABD pad. You need clean gloves. I'm going to set those right over here. Sterile gloves. Need a waterproof disposable. Usually you're going to try to find your biohazard bag, which most of your facilities will have. An ink pen to do your documentation on the dressing, and a waterproof pad if needed. You still need this. It just helps keep the bed linens neater and things like that. So now we're going to get set up for it. We're going to verify the expiration dates of anything. Anytime you have a solution or anything, we see this is good. It doesn't expire until August of 2013. Sometimes your equipment will have expiration dates on it. This is guaranteed sterile until 2013 as well. So just kind of glance at your expiration dates as well. As I introduced them to you, I put them on an overbed table, and you want to be on the side nearest the wound. We're going to want to do our hand hygiene, introduce ourselves to the patient. Once we get the hand hygiene stuff working. Hi, Mrs. Smith. My name's Lisa. I'm your nurse today. Can you tell me your full name? And what's your birthday? I've identified her. She is who she says she is. Do you have any allergies? She doesn't have any allergies that we know of. I'm also at this time going to address her level of pain. Can you tell me what your level of pain is right now? On a scale of 0 to 10, 0 is no pain at all. 10 is the worst pain you could possibly imagine. If she says her pain's around a 2, we're okay. If she's having a lot of pain, we might want to check the record and see if there's any pain medicine analgesics that we can give her at this time, and wait about 30 minutes before we start the dressing change. We're going to explain the procedure to the patient and their family as we go through. And we're also going to make sure we provide privacy. Doors shut, different things like that. We're going to perform our hand hygiene again if necessary. And we're going to, at this time, apply our PPE, and we're going to do it with non-sterile. You can apply a mask with a shield if you think splashing is likely. This bed is at a comfortable working height for me. If you were taller or shorter, you would want to raise the bed accordingly. Use the bed and let it work for you. Okay? We're going to position the patient comfortably. We'll ask her if she's comfortable, and then at that point in time, we're going to start exposing the wound. Again, this is the part where you're providing the privacy as well. And this way we've got her covered, but we've got the wound exposed, and we can use the waterproof pad. This way, if we have any drainage, it should catch on the waterproof pad instead of soiling the linens and everything around it. This time you might want to tell, believe it or not, you might want to tell the patient and family, you know, do not touch your supplies that you're going to open shortly. Don't touch the wound. Tell them you're doing a sterile procedure and you just need their assistance in not touching anything. This time you're going to take your biohazard bag and you're just going to make a cup in it where it will stay open and set it within arm's reach, because you're going to be throwing away stuff here pretty shortly. Okay, if you needed at this time, if the wound was messy or if you've gotten into something, you perform your hand hygiene again and make sure that you got everything done. Now what we're going to do is we're going to very carefully, you don't want to just rip this pad up. You're going to hold it and you're going to lift it parallel. A lot of people have a tendency to want to jump that off. You're going to kind of pull that tape out to the side, and all you're doing is loosening it at this point in time. And sometimes this is the most painful part for the patient. You're constantly reassessing the patient and trying to be as gentle. You don't want to pull on the skin. You can touch down against the skin and pull it away from the tape, but you don't want any more damage to the skin than what's already done. Now, this is very important. You don't want the patient to have to see what their dressing looks like at this point in time. You also want to contain anything that might have drained into it. So, what you're doing is you're taking the dressing, you've loosened the tape, and you're folding it under as you come up. Just like that. Okay. Then you can take the dressing off. That point in time, if you needed to look at it, if you weren't able to see it as you were pulling it up, you could. But the idea is for the patient not to have to see the drainage, and you can dispose of it in your red bag. And at this point in time, we're looking at the wound, we're seeing if anything's draining out on it. If it's not so deeply packed and everything, I can take, very careful not to touch the edge of the wound. I'm going to take the dressing out, take a look at it as I go through, and put it in the soiled. Same thing with the next dressing. I'm going to take a look at it, and now you can see why we have the waterproof pad, and put it in the biohazard bag. Now I can see the wound. I can see if there's any extra drainage, and I'm keeping this all in the back of my mind right now. Also, I'm going to check around the wound, make sure that I haven't left any pieces of tape